Yes, hello everyone, welcome back to my channel. Thank you for clicking. So in today's video I want us to talk a bit about mpox disease. On 14th August 2024, the World Health Organization declared mpox disease as a global public health emergency, and this is actually not the first time this is happening. It's been happening over the years. Just to give a brief history, mpox disease has existed since the 1950s. Just that at first it was known as more of a zoonotic disease occurring majorly in animals. And it was first detected in 1950s in laboratory monkeys somewhere in Denmark during the poliovirus research. And then even in the 1960s, it was detected majorly in these laboratory animals and zoo animals, in Rotterdam, laboratory animals in the US. So still it was still confined in animals. However, later in the 1970s, actually, that's when we realized that this particular virus can actually cause disease in humans. And the first cases were identified in Democratic Republic of Congo. By then it was the Republic of Zaire. So that's where we first got the first cases of mpox disease. And ever since then, we've been having sporadic cases and some outbreaks. For example, the major outbreaks that right now that have been noted was in 2003, and then even 2022, May 2022, an outbreak. We had an outbreak, and then now 2024. So in today's video, I want to highlight some of the important things we need to know about this particular disease for safety. So mpox disease is a viral disease caused by monkeypox virus, majorly zoonotic, coming from animals, and in humans it causes majorly skin manifestations. It can affect the general well-being of a human being. It can also affect various systems, for example the eyes, the brain, the everywhere. These viruses can actually cause various derangements. This virus actually occurs in strains, though here I'll call them clades 1 and 2, which both have clade 1A and 1B, then 2A and 2B. And these differ in distribution patterns. We realized more that clade 1 is more in Central Africa and clade 2 is more in West Africa. Why the regions which are affected and why now? The regions affected basically, mpox is a zoonotic disease. It comes from animals. So in any area that has a lot of rainforests, realize that there is increased chances of human-animal interaction. So it's been found that actually most of animals implicated here are rats, squirrels, tree squirrels, and different species of monkeys. So the closer the interaction we have between the humans and these animals, the more the chances. Because through body fluids of these animals, through bites, or through meat that is minimally cooked or raw meat, it's the disease is transmitted to humans. And why now? According to WHO, there's a thought that actually previously, we used to have monkeypox, which was eliminated, and vaccination stopped. So, and stopping the vaccination means, remember that the smallpox virus called the variola virus, Vaccinia virus, and then this monkeypox virus belong to the same group called the orthopox viruses. The vaccine that used to be given was Vaccinia based, and it used to give protection against smallpox and mpox. So when smallpox was eliminated, vaccination was stopped, which means this increases the chances of now mpox cases raising. I think that could be the reason, for this. And the variants currently have increased human-to-human transmission. So that, like the clade 1B, that is currently, it's more in the DRC, it has high human-to-human transmission, and that's why these outbreaks are coming up. How is it transmitted? Once it's in us, the humans, still it continues to spread, basically on a household level, in healthcare settings. Someone who is infected, at first symptoms may not be very obvious, but of course they're infectious. For example, for cases, because this thing can actually transmit via direct contact, that is with their body fluids, for example, the lesions, if you're the caretaker and you have to interact with this person daily, if you have to get in touch with their clothing, their utensils, their masks, all these things, there are most chances that you actually get infected. And then also, still on a household level, respiratory, being in the same environment, a person, yes. So that's why these patients actually encouraged to have masks on. And then also vertical transmission. If a mother, is suffering monkeypox, there are chances that they will actually transmit what? To the baby, the unborn baby, congenital mpox. In healthcare settings, it's when you don't immediately recognize this particular disease. That's why we need to be informed about the early signs, such as these particular cases are immediately isolated. So in cases where there is late detection of disease and you find that the healthcare provider has already interacted with all fluids, they're most likely to get infected or even infecting other patients in a hospital setting. And then generally in cases where there is no personal protective gears like gloves, so interacting directly with with an individual, examining these lesions without protective gears, I will get you infected as a healthcare provider. And then also, it also goes ahead to waste management in hospital. In case of dumping of these particular maybe causes or cotton used to clean the area. So in case of poor waste handling, there are most cases that the waste handlers will actually get into contact with the virus. Then it has also been identified to be spreading sexually, and that's how it's extending to more areas. Yes, it's in the previous endemic areas, it's been noted, but currently, even non endemic areas now, it's been noted in areas like Uganda, Burundi, Rwanda, so the neighboring areas. In one of the studies that was done, actually, it was found out that some of the cases were more in females at 52% and more in sex workers at 29%. So you can see why sexual transmission is implicated in this case. So basically, that's how the virus transmits. What are the early signs that you need to note and seek help? So basically, it's not that it will start with a rash immediately. Understand, most people know about the rash. Sometimes it starts actually, in most cases, it starts with systemic illness. You may start with fevers, rise in temperature. You may start with chills, then you may also get muscle pain or myalgias. You may get headache. You may get back pain. Basically, the body is trying, the immunity, the immune response is what will give us all these manifestations. Then later, that's when in most cases skin lesions come in. Though we have people who have skin lesions without systemic illness, without those general illnesses. So the skin lesions, basically they keep changing over time. Start as macules, turn into papules, vesicles, and then pseudopustules like that. And usually they have a central umbilication, you get. And they tend to, with time they crust. The other side of the papules, the macules, the vesicles and the pseudo pustules. Usually it's painful. And then this side, towards the crusting stage, is usually itchy. And it depends on the site of inoculation. If it's sexual contact, genital, you may have a genital pustule, you may have an annual lesion, you may have an oral lesion, you may have a skin, maybe if it was a microabrasion of the skin, that's where like the site of entry is usually that's where the most likely the lesion will develop. And other than this, actually some of the disease, mostly if you're immunocompromised, in cases of HIV disease, in cases of diabetes, in case of malnutrition, all these things you may actually present with complications. Yes, it may not be limited to the skin and systemic illness. This disease can go ahead to actually affect to up to the brain. This is encephalitis, like infection to the brain matter. It can affect the eyes, you know. So it can affect, can give you proctitis, anorectal pain, tenesmus, all these things. So all these, when you identify them, or if you identify a fever, and especially when you have a recent travel to the endemic area, it does not needs to be given the attention it deserves. Yeah. So once you've detected them, what next? Is this condition treatable? I'd like to emphasize the fact that this condition is treatable and curable. So early detection and treatment is available, both supportive and antiviral therapy, all these are available. And as for the outbreak, so what should be done? I would advise that in case you're diagnosed with mpox, you don't leave home, unless going for the follow-up visits to reduce transmission. And if going for the follow-up visits, a public transport should be avoided. Then, while at home, still on the household level, we advise that in case of extensive lesions, for example, on the face, known areas that cannot be covered, you should actually isolate. Yes. Though also sometimes the lesions may be coverable, but we know there is a respiratory spread. So we advise that you isolate, and then the person interacting with this individual, the caregiver, should have some disposable gloves or have something, whatever you use while handling this person, should be disposed afterwards, and then proper hand washing done. Hand hygiene is very important both for the patient and the caregiver, such that we limit transmission via hands. Hands are uncontrollable. Then limit visitation by friends, relatives until the person is no longer infectious. And I mean, when no longer infectious, we know when the scabs, the skin scabs are all fallen off and reepithelialization has occurred. That's when we consider someone not infectious. But as long as they are still present, this person is infectious. Let's limit visitation. Then let's limit sharing of, utensils, clothes. All these can be modes, can be items through which the virus can be transmitted. The patient should have a well-fitting mask to reduce respiratory spread of the illness, to protect the rest of the family members. And then also, after recovery, we advise consistent condom use for at least 12 weeks. That's when, because we know there is a bit of sexual transmission in these particular cases. Then in hospital, healthcare settings, we advise that actually you should be knowledgeable about the first symptoms, tell signs of this particular disease, and these patients should be isolated, to avoid interaction with other patients, to cause spread, and then also in most cases, to limit transmission, and then interacting with any patient using protective gear like gloves, and proper hand washing. Then, in case of wastes, mosquito waste should be properly managed. Otherwise, they can be a source of infection to waste handlers. So basically, that's what I can talk about monkeypox virus. Let's protect ourselves, let's protect our loved ones, and for those that are infected, the disease is actually treatable. And in addition to the preventive measures, we actually have vaccines available, for prophylaxis, and which are being given in various regions through the WHO response measures. So basically, that's what I can say about monkeypox virus. Stay safe.